Welcome back, everyone. I'm super excited to have in studio with us today Maurice Blitz, Chief of Surgery at KGH. Welcome.
Thank you very much. Good afternoon.
Thank you very much for coming. Can you tell us, let's start, maybe if you can tell us your role at KGH and a bit about what you do on a daily basis.
So I have two roles. I'm Chief of Surgery, as you said. I'm also one of the thoracic surgeons at Kelowna General Hospital. So my daily role is essentially seeing patients, and dealing with their issues, either operating on them or helping them through the system to get where they need to be and get the treatment that they require. As Chief of Surgery, I help amongst a large team organize and run the Department of Surgery at Kelowna General Hospital.
Dr. Blitz, you have been an advocate for bringing in robotic-assisted surgery into KGH. Can you tell us a bit more about what robotic-assisted surgery is?
I'm happy to do so. Thank you for that opportunity. The robot, although it sounds very futuristic and very sci-fi, in reality, it's just an extension of the surgeon. And what the robot does, it allows the surgeon to operate in very confined spaces with great precision and better visualization. And so it gives us the opportunity to perform some surgeries with better oncologic outcomes, other surgeries with fewer complications, many surgeries with both better oncologic outcomes and fewer complications.
So you have been advocating for this robotic-assisted surgery at KGH for some time now. What excites you most about finally having this vision become a reality?
What excites me most is it allows us to maintain the high level of care delivered at the Kelowna General Hospital. So for a small, in quotes, community hospital, we deliver an amazing breadth of care in the surgical department. There are very few surgeries that happen that we actually don't provide here in Kelowna. And what the robot allows us to do is allows us to stay at the leading edge, which is, I believe, what the people of interior health rightly deserve.
So Dr. Dr. Blitz, pardon me, this doesn't replace the surgeon in any way, shape, or form.
Absolutely not. It's an extension of the surgeon. It allows us to see with greater precision, and the optics are phenomenal. Before, the big change was going from big open surgery to minimally invasive surgery. We've all heard about that, operating with the telescopes. The telescopes are essentially a stick with an instrument at the end, but they don't have wrists. What the robot does, it allows us to add wrists to this. So instead of just being in a straight line and operating at the end, it allows full 360-degree movement in several planes, thereby giving us much better opportunity working in very confined spaces, allowing us to avoid the things we want to avoid when we're there, and allowing us to remove the things we need to remove.
So that is a significant increase in adaptability, or it's huge. We're going from quite fixed.
It's almost like we're going from operating in two dimensions to 3 dimensions. It allows an extra level of control and precision that we've never had before.
And can you explain to me why this technology is labeled a gold standard in surgical care, or is it a gold standard now?
In some surgeries, it is the standard. In other surgeries, it's rapidly becoming the standard. And again, it's because it allows us to do very precise surgery, getting us the outcomes we want as far as oncologically appropriate outcomes, but while at the same time minimizing the complications or harm to the patient.
Dr. Blitz, what types of procedures would we see? So first off, there's one of these at KGH?
We're starting with one.
Okay. So what types of procedures will benefit initially or the most?
So at the beginning, we're starting with the services that we're starting with. The procedures that will be most robot friendly or utilized will be things like prostatectomies, by the urologists, lobectomies by the thoracic surgeons, rectal surgery and colorectal surgery by the colorectal surgeons. And what these all have in common are their surgeries that happen in a very confined space. And so it allows us to get a multitude of instruments in a very confined space, thereby making it easier on the patient with smaller incisions, making it easier on the patient with fewer complications, and allowing us to perform the surgery from an oncology perspective as good, if not better, than we've ever done before.
So if we have more accuracy, a better surgery, a smaller incision, recovery.
Recovery in many of these operations are better, the complications are fewer, and the outcomes are improved.
Win, win, win. How do you see this program shaping the future of healthcare in this region?
Oh, I think this is just the start. This is the tip of the iceberg. As more and more surgeries are going to be done robotically, more and more specialties will be involved with a robotic program. If you look at the best trained surgeons in Canada right now, they're all leaving programs where their training is that include robotic surgery. And we've been getting the best surgeons here in Kelowna, and we want to keep recruiting the best surgeons in Kelowna. So now we're going to have the tools that they're used to working with.
That's fascinating. How many of these robotic assisted devices or machines are in the interior?
And this will be the first one.
Of course it is. I love that. What does it mean to you personally to be bringing in this type of life-changing technology into this region or into the interior of the province?
It's a great victory for the Kelowna and the interior. As I mentioned, the department right now is full of surgeons that are as good as surgeons anywhere in this country, and they want to stay at that leading edge. And for them to stay at the leading edge, they need the best equipment. And this is that best equipment that allows us to perform at the best of our abilities, which again is what the people of the interior deserve.
And I was just going to say, as a community and as a region, it's really important that, of course, we want the best care, and being able to have technologies like this and attract the talent that you're describing here is certainly something that is amazing for our region.
Absolutely. And again, I want to reiterate the fact that we have the best care here already. We have the surgeons that deliver a level of quality that is unsurpassed, but we want to stay there and want to keep recruiting to that level.
So, Dr. Blitz, I understand we're in or approaching a day of giving, a donation, an opportunity to contribute. If you could say one thing to a potential donor, either an existing or someone that's never ever donated before, what would you say?
Well, I think if one sits back and really thinks about what life is like in the Okanagan, hopefully they never have to use the hospital. Hopefully their families never has to use the hospital, and hopefully their friends never have to use the hospital. However, life being what it is, almost certainly someone in their sphere, if not many people in their sphere, will at some point come to KGH and will at some point need surgery. And they deserve the best quality of care that we could possibly give them. And one of the ways to do that is to allow us to have the best technology. And this is that technology that we need to continue giving that high level of care that they're so accustomed to.
And I'm confident we want much, much more of it. So thank you so much for spearheading this program and for advocating for us to have this robotic assisted surgery right here at KGH. Where can people go to find more information about a day of giving or donating or anything that's going on at KGH?
They can come by the hospital anytime, or alternatively, from the convenience of their own home, go to www.kghfoundation.com.
Super, super excited. Last question that I'll ask you is what excites you most about the future of robotics program at KGH?
What excites me is that this is the start. This is just the beginning. I think if you look at KGH 5 years or 10 years from now, we'll be able to point to the first robot as the beginning of sort of the new wave of surgery that we'll be able to provide here.
Dr. Blitz, thank you so much for coming in and sharing this wonderful news with us. And we hope you will seek out the opportunity to donate to an incredible Kelowna General Hospital.
Thank you very much for the opportunity.
Thank you.